This is News 8 at 11.
We are headed to a voter revolt in the state of California.
Outrage tonight over a plan by Blue Shield to hike some health insurance rates as much as 59%. Good evening. The healthcare battle is far from over.
News 8's Richard Allen is live tonight with the reasons behind the hike and the push to stop it in this consumer alert. Richard?
Well, Carlo and Barbara Lee, California's new insurance commissioner is leading the charge to crack down on what he calls excessive rate hikes by Blue Shield, expected to impact some 193,000 policyholders statewide.
It was a 59% rate increase. It caught me off guard.
Insurance broker Craig Gussin has hundreds of clients insured through Blue Shield who are now receiving letters that their premiums are about to jump, some as high as 59%. Blue Shield says the increase is in response to rapidly rising healthcare costs.
I'm hearing outrage. I'm hearing how can they do this? I'm hearing what are my choices?
One choice is to simply switch companies.
There's 7 companies in California that you can buy health insurance from. So if Blue Shield's rates are totally out of line, a lot of clients will move to one of the other carriers.
We have seen these rate hikes year after year after year, which is causing a real problem for Californians and California families. So
California's new insurance commissioner, Dave Jones, has asked Blue Shield to put these hikes on hold for 60 days while he reviews the insurance company's rate filings.
Unfortunately, under California law, I do not currently have the ability to reject excessive rate hikes. I've fought to have that authority for quite some time now.
Jones is asking the state legislature to give his office the same regulatory power over health insurers it currently has over auto and home insurers, a move consumer advocates are championing.
Doctors, hospitals, and health insurers are in cahoots to raise prices as high as possible because they have every incentive to charge as much as possible until government stops them.
Gussin believes these rate hikes are in response to new federal government requirements for insurance companies under healthcare reform, like guaranteed coverage for children.
Because of that, the health insurance rates are going to go up to justify the expenses.
But in a statement, Blue Shield says these new rate hikes have, quote, almost nothing to do with the federal health reform law, adding that these rising medical costs have been building long before healthcare reform. Barbara Lee?
Richard, thanks. Blue Shield also claims that even with the increased premiums, it still expects to lose tens of millions of dollars on its individual healthcare business in both 2010 and 2011.